I have a lot of pride in being able to serve, because my grandfather served. I have uncles that served. What stands out for me during my time in the service was when I was stationed in Korea. I had just gotten married. I was with the 2nd Infantry Division Artillery. I did a lot of training of other soldiers who were going to go into combat. And I'm not going to try to sound conceited, but I was damn good at what I did. And I was in communications, but when they left to go over to the Middle East, I felt right here, I felt confident that I had done my job good enough that they would be able to communicate with other units. They would be able to call for air support if they needed it. They would be able to call for a chopper if they had wounded. All that stuff mattered a lot to me, because I would look at those people and I would think, you know, if I don't do my job good enough, there's a family who's not going to see them again. And yeah, that makes me proud. How can that not make you proud? I left the service in 2005. I was involved in a training accident in 2004, which led to back surgeries in 2005. They didn't go as planned. Got to the point where I really couldn't run no more. So at that point, I was medically discharged from active duty. At that point, I was at 10 years. I was 10 years shy of where I wanted to be, but circumstances, you know, played a part in it, and I couldn't continue, so I got out. My care has been troubling at times, but positive at times. Shortly after I was discharged in 2005, I was put into the VA medical system, which I now call the VA Medicare system. It started out okay. I was in constant pain. They did distribute narcotics, painkillers, opiates, whatever you want to call it, like it was candy. They had to. They were so understaffed. They didn't even have close to the number of people to be able to handle the patients that they had. My worst day was September 7th of last year. And I was seeing a spine doctor who decided he wanted to try to taper me off of medication I'd been taking for 13 years. And do that in order to see how well it was working. So as I came down off of that medication, and close to the time I was done taking it, my mental health took a quick dive. 1 week, a Tuesday night, I'm sitting at home and I just started having some weird thoughts, and I knew they weren't good thoughts. And I really didn't even think about it, but something told me, you know what, I just need to go to the hospital. So I ended up at the hospital, and they eventually sent me to a crisis center. I spent the night there, and after talking to them and feeling totally different the next day, they let me go home that morning, which was Wednesday. That Wednesday, I was fine all day. That Thursday, I was fine all day. In fact, that Thursday afternoon, I was on the phone with another veteran, trying to get him to go to the hospital, or trying to get him to allow me to contact another veteran who would come and talk to him that was close to him. But then Friday came, and that's when everything just got out of control. During the day Friday, my thought process was definitely not where it needed to be. I will not lie, I was thinking about hurting myself. I had no thoughts of hurting nobody else. But eventually, family members called law enforcement got involved, and it just went downhill from there. I'm very, very lucky I didn't get shot that night, because it could have happened very easily. I did have a weapon on me, but thankfully the law enforcement officers were able to get to me and get me on the ground before anything real bad happened. The first time I ever tried medical cannabis, I had a fellow veteran convince me to try it. And he said, you know, just try this for a week, use a little bit before you go to sleep, and try not to take any of your pills, and, you know, see how you are after the week. I mean, the first night I slept for 8 hours, which I hadn't done in probably a decade. I woke up, I felt refreshed, but the real good thing is when I looked out at everything, when I looked at the world, my eyes had a different perspective. They had the perspective that, you know what, I feel healed. I feel different than I did yesterday. I feel better. I feel like I can challenge anything that comes before me. When you deal with pain every day, day after day after day, month after month, year after year, you get tired. But there's a huge difference between being alive and living. And with the veterans, when they're in that type of situation, they're just alive. I mean, they're not going out and doing stuff. They're not doing what they love to do. You know, and doing all that stuff is part of what makes you happy, part of what gives you internal joy. And when you don't have that, the darkness sets in. But cannabis, medical cannabis, it helps that.
We need to stop talking about this and just get it done already. Words are nothing without action. Patients first. Thank you.
Right now, I've been doing this for 4 years. Things have picked up a lot. I'll get phone calls from veterans on a daily basis, emails, text messages. They want advice. They want to know, I mean, is it really going to cost me an arm and a leg if I get on the state program and, you know, I use the state dispensaries to get my medication? I mean, they have a lot of questions, and they're questions that we answer. If I get in contact with a veteran, or a veteran gets in contact with me who's possibly in a crisis situation, I mean, I'll talk to them. If I'm close enough, I'll drive to see them, but I'm gonna tell them straight up, you're having an issue right now. You're not able to carry yourself, okay? So get on my back and I will carry you for you. And we will tackle this together. You know, if the darkness is getting too dark, I will bring my flashlight and we will find the light. I'm Jeremy Sankey. I'm a 10-year disabled veteran in the U.S. Army. I served from 95 to 2005. I'm the founder of Minnesota Veterans for Cannabis, an organization that was started to help veterans get away from taking all the deadly opiates that the VA was giving them.